So, Mr. Lawyer Man. All right. He has damage to left frontal. Tell me what that's going to do to him. He cannot speak, possibly, frontal lobe. What else could he possibly not do? Problem solving, right? So he can't not move, not speak. How do you spell speak? That's not how you spell it. What is that? Not speak, maybe some problems thinking, which all lawyers, I think, do. All right? So give me something more physical.
Motor control.
Motor control. So no motor. Where on his body would he have no motor? The right side, because of the cassation. So he couldn't move his right body. Left parietal lobe. What's going to happen to him? Okay, possibly no understanding, because that's the Wernicke's. What else would he have problems with the left parietal?
Feeling.
Feeling where?
Right
No,
side.
feel the right side. Right? Okay, and cell death in his cerebellum. Therefore, he has no longer any balance and coordination. Can't stand, can't walk, sways. Right? All those would be perfectly good answers on a test. So yes, you don't know specifically if he can't speak. That's a reasonable extrapolation. Right? Make sense on how we did that? So I gave you the parts, you gave me the symptoms. Very good. Next one, Mr. Vic is karate. All right. This actually doesn't ask what part of his brain got damaged. It asks you how it did it. Because he didn't hit his head, it squeezed his neck. So what are we cutting off when I squeeze your neck? Blood flow. That's why you go in a coma. What part of his neck would I squeeze to shut off his blood flow? Look here.
Carotid arteries.
Carotid artery, which we're going to learn in about 5 weeks. But for today, just know it's the carotid artery. It's the one in your neck. So I squeeze that, blood doesn't get the brain. You're having a stroke from the neck. So, middle cerebral artery. Let's go over here. Which parts is it going to serve? Temporal and frontal lobes. Let's see if that's true based on his symptoms. His right arm and leg suddenly went limp and weak, and he was unable to speak. Is that possibly one of these? Frontal lobe would do that, right? I can't move it, I can't talk. That makes some sense. All right? Let's go through Mr. Cholesterol and plaque. What do they do?
Block blood flow.
They block your blood vessels in my neck, so less fluid gets to my brain. My brain has a harder time staying alive. Okay? Make sense? Okay. Very good. Now we get the doctor speak. Actually, out of a real case. Here we go. Hypometabolic means low metabolism. It means the cells are slow and or dead or dying or turning off, right? So we can interpret this as the cell's not working. Your brain is shutting down. Your brain is turning off. You're dying. Okay, does anyone know cortex and subcortex? What part of the brain is the cortical or cortex part? The surface. Very good. I'm going to show you a picture that shows more or less that concept. Here's a picture showing the meninges. There's subarachnoid space, and all those things you learned. I'm interested in this picture. Here, notice there's two colors in the brain. There's the darker one here. The lighter one here. That darker one is the outside edge, the gray matter. So what do we call the outside edge of your brain? It's the cerebral cortex. So the cortex means the superficial, outside the part you touch. Therefore, this area is below the cortex. How would you say that, doctors? Subcortical, below the cortex. So the brain has an outer layer, cortex, and a not outer layer, inner layer, deeper layer, subcortical. So the gray matter you'll do in lab tomorrow is the cortex. The white matter is the subcortical. So go back to these pictures here. Let's fill those in. Maybe. Boom. Cortical means surface, superficial. Surface. Subcortical means below that. So you hear a lot of people talk about the cerebral cortex. They mean the outside of the brain. That's what they mean. Now we're going to do our quiz question. Give me some symptoms. We're going line by line. Blah, 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 blah. Temporal lobes. What's going to happen if I lose my temporal lobes? I will no longer possibly hear memories or hearing. I can't hear the words. Cerebellar, meaning my cerebellum. If I blow that, it is going to be hard to balance and coordination, motor control. Spotty, blah, 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 in blah, 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 frontal lobes. Can't think, can't move, can't talk, can't make words, right? Exterior, extensive, in the midbrain. That's the mesencephalon, the three things over there. So let's name the three things. What were in the mesencephalon? Nope, that's diencephalon.
Eyes and the ear reflex.
Close enough. The corpora quadrigemina, we said eye and ear reflexes. So if I damage my corpora quadrigemina, my eyes can't, what? What could my eyes not do if I damage the reflexes? Dilate and constrict. I can't blink. I can't tear involuntarily. My ear reflexes, I can't turn sounds. Okay, so what else in there? The cerebral aqueduct was in there. So what happens if you damage your aqueduct? Can't drain the fluid. The peduncles were in there. What would happen if I damage my peduncles? Information can't get up to my brain, right? So that's another thing you can think of is the more primitive parts. Make sense? So those would be reasonable answers. So again, that's your goal for your quiz. If I gave you symptoms or places, you could rattle off, this is what's going to happen to the patient. 1, 2, 3, 4, 5. Make sense? So right from left, the arteries that serve them, the places and what they do. Make sense? You're not done yet. We have one more topic to cover. Less than 10 minutes, I hope. Generally 8:30 is my goal. For lab tomorrow and lecture next week, thou shalt know the cranial nerves, thou shalt. So we're going to walk through the cranial nerves, which are the nerves of your brain, because thou shalt know them.
That's later on.
This is both for lecture and for lab, so you might as well start now. All right, we're going to make a big ugly chart that thou shalt know. So for each one, PCC says thou shalt know the number, the name, the type, which we'll talk about, and its general function, what it does. There are 12 cranial nerves. You're going to have 12 rows of this column. We'll put 6 here and 6 there. Okay? So let's go through. They're on this picture. There's kind of a logic to them, in vaguely logic. They start numbering them in the front of your brain. That's the front. And they kind of go down and number them as you go down. So they start 1, 2, 3, 4, 5, like that. Okay? Start with number 1. Number 1 is that one. So numeral 1. By the way, there are 2 ways to write the number. I learned Roman numerals, which you see there. If you don't know Roman numerals, you are allowed to write Arabic numerals as long as you put CN Arabic numerals. So those are synonyms. On a quiz, I'm fine with it. If you don't know Roman numerals, don't write them and get it wrong. I'm amazed on finals when people tell me that that's a 3. Well, that's wrong. You just lost the point. That's not number 3, right? That's a 9. So if you learn either the Roman numerals or use the Arabic, but pick one, okay? So Roman numeral 1, what's its name?
Olfactory.
Olfactory. We're going to list the numbers and names first. Number 2 is optic. Number 3, oculomotor.
Motor.
Number 4, that's a pretty color.
Trochlear.
Number 6, number 7, trochlear. And we have, let's see, our number 5, trigeminal. And number 6, which is that one?
Abducens.
Abducens. Sometimes you'll hear abducens. I'm okay with that. It's wrong, but it's okay. So we have olfactory, optic, oculomotor, trochlear, trigeminal, abducens. So the first 6. We're going to put the next 6 over here. So 7, 8, 9, 10, 11, and 12. So number 7. What's number 7? We're going to start here.
Facial.
Facial. Number 8. Vestibulocochlear. I'm putting a dash in it for a reason, which I'll show you in a minute. Vestibulocochlear. Number 9. Glossopharyngeal. Number 10. Vagus. Vagus. Number 10. Number 11 is actually over here. That's accessory. And the last one is your hypoglossal. All right. So these are the only 12 in order, and their names. So you're supposed to go online and find lots of dirty little rhymes to help you remember these. All right? So let me give you one to help you. But when I learned when I was a freshman in college, it's not that dirty. On old Olympus's towering top, a fine virgin girl viewed a hop. It makes no sense. I remembered it from 28 years ago. Right? So just learn them in some kind of order and sequence. Everyone over 18? Good. Let's do the other one. Oh, 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 to touch and feel virgin girl vaginas and hymens. Thank you. Right? So pick one, but pick something that you're going to memorize them in order. Okay? Now we have to go to the type, what they do. 3 choices for the type 1. I'm going to use 3 letters to represent the different types. S is sensory. Can someone tell me what a sensory nerve does? Feels information in, input, afferent, brings information into the CNS. What do you think M is going to be?
Motor.
Motor. Can someone tell me what a motor nerve does? Moves out,
efferent,
away from the CNS. Right? B is both. Now Saladin will say it's mixed, but I didn't want the M's to confuse you. So I'm using a B to mean mixed means it does both, in and out. All right? So you have to know the type for each one. So we're going to go through each one. Okay, SSMMBM, BSBBNM. Right? There's 2 ways you can do that. One is memorize it, which I did. The other way is to think about it. Smell, I sense smell, right? I'm moving, motor, moving, right? So some of them, the name will tell you somewhat what they do, right? Let's do the dirty rhyme. Some say marry money, but my brother says big
Brains.
Sure. Matter more. Right? Some say marry money, but my brother says big butts matter more. Right? That's how you memorize. But that tells you what they're doing, if they're an in or an out or both. Make sense? Now we got to figure out what the function is. All right. What do you think olfactory sense is? Your smell. So the job of the olfactory nerve is to carry information from my nose to my brain so I may smell. Okay. Optic does what? Sensory for seeing, vision. From your eye to your brain. Remember the optic canals in your skull? Okay. Hazard me a guess, yay, what oculomotor means. Moving my eye. Also, it does your eyelids, your eyebrows, all the eye stuff. Winking, blinking, that's all moving my eyeball, in addition to the eyeball itself. All right. Trochlear. Moves my eye. So what I'm going to do is I'm going to give you the specific muscle it moves, so you know which one it is. Trochlear is called the superior oblique. That means nothing to you now, but you're just going to memorize the superior oblique. That's the muscle of your eye in the corner that moves. It goes through the trochlea, which is the pulley. Trigeminal.
Hearing.
There are 3 parts. And the way you memorize this for your nursing class, you put your hand like this. All right? So one part goes to my eyeball, one part goes to my upper jaw, one part goes lower jaw. So what would I do in those 3 parts? Especially these 2. What are these for? What's your jaw for? Chewing. Very good. So trigeminal does your jaw, your teeth, your face bones. Let's put it that way. Your maxilla. What am I doing? Is it moving them, feeling them, or both?
Both.
Both. It's both. It's mixed. Your dentist lives with this nerve, right? They numb your jaw by hitting the trigeminal nerve so you don't feel your teeth, you don't feel your jaw, you don't feel here when they're drilling a hole, right? they have to live with that. Abducens or abducens moves the eye. Again, you have to know it's the lateral rectus muscle. And no, you don't know where that is yet, but you will. Here's a little trick. The oculomotor moves all the other muscles but those two. So I only memorized the two oddballs. I know everything else is the oculomotor. So whatever they are, there's 4 others. They're up here. Superior oblique and lateral rectus are this one. This pulls your eye to the side, makes it abduct, which is where they got the name abducens. Okay. So okay so far? Over here. Tell me a guess what facial nerves control.
Face.
Your facial expressions. Things like taste, expressions. Okay? That's different than trigeminal. Trigeminal does the jaw, but this does your face. So smile, you're using number 7. Okay, vestibulocochlear, I put a hyphen in to tell you there's 2 jobs. One is vestibular, one is cochlear. You learned this word last term. What's the vestibular system for? The spinal vestibular tract was to maintain balance. So there's balance and hearing. So what part of your body does both balance and hearing? That's the ear. So your cerebellum understands balance, but the ear is where you feel your balance. I'm sensing my balance. Right? Glossopharyngeal, medical terminology, where's your glosso? That's your tongue. Where's your pharyngeal? Back of your throat. It's just the back of your throat. Your pharynx, back of mouth. When you gag, that's where you are. Vagus means to wander. This is your internal organs. Name one that's innervated by the vagus nerve. It's right about here. Heart, stomach, go to vagus, tells your heart to slow down, tells your stomach what to do. You'll throw up if I push your vagus. Right? Accessory. Okay. In the Dark Ages, this had 2 names. They actually put the word spinal in front of accessory. That's not how they name it now, but that will help you where it goes. It goes down my spine to my neck muscles. I'm sure you remember all your neck muscles from last term, right? Yep. Liars. Right. But the muscles of my neck are coming out of my accessory nerve. It goes down my spine to my neck. Hypoglossals, below my tongue. Very good. Lower part of my tongue. Those would be good answers on a test. So thou shalt memorize this table. Name, number, type, and function. The dirty rhymes? Which one? Oh, I keep my job, right? Okay. I heard this on the internet. The dirty one?
Yeah.
Okay. O, to touch and feel virgin girls' vaginas and hymens. This one. Some say marry money, but my brother says big boobs matter more. There are other ones. Right? Make me sound like a perv today. All right. To show you a possible thing here. This is a website. I've just pulled one up. There's lots of websites to help people. Let's see if I'm true. This lists their jobs. Okay, so smell, yes. Vision, yes. Eyelid and eyeball, moving my eye. Trochlear, the superior oblique muscle only. Chewing, face, mouth, jaw, dentist land, trigeminal. Turns my eye laterally, abducts my eye. Facial expressions, tears, saliva, taste, mouthy things. This one is hearing equilibrium. Again, taste, back of my throat pressure. This does my internal organs, my trapezius sternocleidomastoid, and this is my tongue. So thou shalt memorize those. Thou shalt. Make sense? In life you got to find them. In lecture you got to know this chart. So next week, quiz on can you do strokes, CSF flow, cranial nerves. Make sense? Thank you for shopping here. See you next week. You need to be on the wait list.